what's up beautiful people? This is your tooth doctor, Maureen Mora. Welcome back again to my YouTube channel. All we do here is talk matters oral health because I believe everybody is entitled to good oral health status. And guys, in today's video, I want to focus on a situation that causes a lot of anxiety amongst parents more than it does to the children who are experiencing the condition that I want to talk about, and that is overretained primary teeth. So, dear parent, if you have a baby whose teeth are not shedding off as they are supposed to, it is better that you get to consult your dentist, or better still, a pediatric dentist who is going to check on the baby and give you a comprehensive treatment plan. So in today's video, where we are focusing on overretained primary teeth or overretained baby's teeth, here we are looking at those teeth that stay in the mouth 1 year more than 1 year after they are supposed to be shed off. So that being said, some of the causes of these overretained primary teeth include if the permanent or successor tooth are absent either partially or completely. If the permanent tooth is impacted, infection, trauma, or generally late eruption of permanent teeth. So here you find out that it is easier for a certain parent to tell that the children are having a quite off way of teeth eruption because they are trying to compare it with other siblings. What I want you guys to understand is that most babies, all the babies, have their own developmental milestones. So if it happened that that particular child has some delayed sort of developmental milestones, the likelihood of the permanent teeth taking more time to come out, and even the rate at which the baby teeth are going to be shed off, can be much way later than a child whose developmental milestones are quite faster. And now once you have established that your baby is having overretained teeth, which you don't know how to go about it, the management depends on the clinical examination or observations derived from the dental x-rays. Either of these recommendations will be made. Number one, your dentist can choose to retain the primary tooth if from the x-ray the permanent tooth is completely missing. So the beauty about retaining these primary teeth is it is going to help maintain on the bone level or the gum level of your jaw. We looked earlier on how the effects of losing a tooth can cause some damages to your gum and even to your opposing tooth. So if the baby has a primary tooth or a baby tooth that is not mobile, or the roots are in a firm condition, and this one can be well seen from the x-ray, then it is okay to have the baby tooth retained into place in that position we were expecting to get a permanent tooth. Another option is to retain and reshape the tooth. Here we are talking about now the baby tooth or the primary tooth still, and here if the tooth, especially if the primary tooth is not aesthetically presentable, reshaping can be done with filling restoration to give good aesthetic appearance to the tooth Again, if it is going to be retained in future, and that is when we don't have the permanent teeth into place. An extraction can be another management plan, especially if your baby has permanent teeth, deflecting from the inappropriate positioning in the dental formula, as in this case. Hii ndio most of the time hii ndio tunaita baby shark teeth. So you get to remove the baby teeth behind there to enable the permanent teeth to come well into place. I normally say this, there's usually an excitement when a parent gets to see their child having their first tooth or teeth in the mouth. But now, when there is a delayed shedding off of this similar tooth, you find that it can be so stressing to the parent, and that is why I try as much as I can to create this video to ease the parent from such kind of pressure. So with the information above, I know it is going to help most parents know when to get worried about their baby's teeth and when not to get worried at all. So thank you so much, guys, again for staying tuned to my YouTube channel. Let us get to meet in my next video. Bye bye.